Sawasdee krap. Good afternoon. Today is Monday, the 10th of January 2022, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration, as always. Thank you, Dr. Sumani, who is the Director of the Risk Communication Division of the Ministry of Public Health. Thank you, Dr. Sumani, for the Thai language briefing just now. We'll start off first with the update on the number of vaccines that have been administered. So yesterday we have 138,885 doses of vaccines. The accumulated number of doses in Thailand is now over 106 million doses, as you see on screen, and we have details of that, of the first, second, and third dose. Importantly, first dose is over 71.5% of the entire population of Thailand. For the general situation, we have new confirmed case at 7,926. The active cases currently being treated, 58,159. New recoveries recorded yesterday was 3,612, with 13 new fatalities. So there have been increases in the new confirmed cases, especially in Bangkok, as the Omicron variant is still on the rise. So home isolation with close monitoring and evaluation by the competent health authority still is the main method for those of treatment for those who are infected. Now, of course, we have to note that the symptoms of Omicron and Delta variant are quite different. Omicron is more asymptomatic. There might be no symptoms, but for those who are infected, as much as the symptoms that we found in the Delta variant. So a recap on the adjustment of measures. We talked about this on Friday. There had been considerable queries on social media seeking clarification on the latest set of the measures. So just to recap the adjustment as follows. The CCSA general meeting last Friday adjusted the zoning categories for disease control measures that took effect since the 9th of January, yesterday. So 69 provinces, almost all the provinces in Thailand, are now categorized as controlled areas, or the orange zone, with the exception of 8 provinces which belong to the pilot tourism or sandbox areas, or the blue zone. So these 8 provinces: Bangkok, Kanchanaburi, Krabi, Chonburi, Nonthaburi, Pathum Thani, Phang, Phuket, including some districts in other provinces in the pilot tourism areas. So the CCSA has asked for the kind cooperation of all entities and agencies to implement work from home measures until at least the 31st of January 2022. Entertainment venues, just now Dr. Sumani recapped this as well. Entertainment venues such as pubs, bars, karaokes have been allowed to apply for permits to operate temporarily as restaurants from the 16th of January, subject to the approval of the competent authorities, and the venues are required to strictly exercise the COVID-free setting measures. For the provinces and areas in the blue zone, consumption of alcoholic beverages is allowed until 2100 hours under the COVID-free setting, and only establishments that have received the SHA Plus certification. Now, just to note that later this afternoon, there will be another briefing by the Ministry of Public Health as well. As for the adjustment of measures for entering the country, the CCSA general meeting on Friday lifted the prior restrictions for travelers departing from Africa. So now, all international travelers from all countries can now enter Thailand under the same scheme. So the same scheme, which means currently the sandbox scheme and the alternative quarantine scheme, because as you know, the test and go is temporarily suspended. In this connection, we have announced the adjustment of entry measures as outlined by the Department of Consular Affairs. I'll recap that again. Travelers departing from African countries can now register for Thailand Pass to enter the kingdom under the Sandbox program from the 11th of January 2022, which is tomorrow, via the Sandbox schemes, meaning in Surat Thani, Phang, Krabi, Phuket, which these provinces are an extension of the Phuket Sandbox scheme to reduce the limited capacities of Phuket. And the quarantine period under the AQ, or Alternative Quarantine Scheme, which they can enter, will also be reduced from 14 days to 7 days for vaccinated travelers and 10 days for unvaccinated visitors. So please be advised that travelers who have been previously approved to enter Thailand under the AQ scheme but wish to switch to a different scheme must re-register for the Thailand Pass. So for Test and Go, as we recapped on Friday, those who have already received the QR code for the Test and Go and are traveling to Thailand by the 15th of January 2022 can still do so as per their approved schedule. But of course, given the global outbreak of Omicron variant, adjustment and measures might be possible. As for new registration under the Test and Go scheme, which has been suspended indefinitely, subject to assessment of the international outbreak of the Omicron variant. As for a lot of talk about the cutoff date, so we've made that clear already that those who have received their QR code prior to this and traveling by 15th of January, you can still do so, of course. But those who have received their QR code prior to this already and you're traveling after the 15th of January, that is being considered by the authorities here at the CCSA whether that will be possible to travel to Thailand after the 15th of January with a QR code that you already have or not. So moving on to the MALPROM for all. The Health Ministry is pleased to inform that the MALPROM application is now more user-friendly for foreign nationals who reside in Thailand. So those who are vaccinated at least one dose of COVID vaccine can now view their vaccine-related information on MALPROM application, which is available on both Apple Store and Play Store. And this effort, of course, is made possible by the Department of Disease Control and World Health Organization Thailand office. And there's a video demonstration that's also available in 4 languages. You have the QR code of that video demonstration for you on screen. And the 4 languages is English, Burmese, Lao, and Khmer languages, as you see on screen. So just in closing, I'd like to point out that the Royal Thai government, especially the health authorities, have been continuing to do our utmost to implement the necessary measures, including home isolation and vaccination rollout program for vulnerable groups, so that the general public are well guarded against the health risks that still pose as a risk to all of us, and the risk associated with COVID-19, especially the Omicron variant. So the newly adopted public health measures are implemented with a view to preventing COVID-related fatalities, while still allowing economic activities to take place and resume with minimal disruption. It's important to bear in mind that each and every one of us has a role to play by strictly following measures, now referred to in summary as an acronym VUCA or VUCA. So V stands for vaccine, getting vaccinated when it is your turn to do so. U is for universal prevention by strictly following the universal prevention measures. C is for COVID-free setting that all establishments need to follow. And the last one, A, is for antigen test kit or ATK. When people feel that they may have been exposed to the virus, they of course should take the ATK test regularly just to be on the safe side. And of course, start of the week protocol, at least in my office and in many offices in Thailand right now, start of the week protocol is to have your ATK test done, and you have, of course, a proof, a photograph of a negative ATK test in your phone in case you need to show it anywhere. All of this, of course, for a COVID-free setting and for a safe and healthy work week ahead for all of us. So with that note, thank you very much for your attention, and we'll see you again on Wednesday. สวัสดีครับ